podcast.
Bring your friends.
Boom. Do apples really keep the doctor away though?
What? I don't know. Why are you asking me that? Like I'm supposed to know what apples can do.
Hey man, I don't know. That's an American saying though.
They don't say that in Puerto Rico, I'm sure.
Fuck no, bro. We don't have we have weird sayings like reason doesn't yell, it convinces. That's a saying in Puerto Rico. That's a saying from the first governor of Puerto Rico, Luis Muñoz Marín.
Reason doesn't yell. It
reason does not yell, it convinces.
Well, I like that.
Really?
Yeah.
I've been saying that for years. That's right. That's why I don't get agitated over a lot of. That's why I don't get agitated over a lot of shit.
The real travel in silence while the fake get loud and get violent.
Ooh, that makes my dick hard. That makes my dick a little hard. I love these fucking Davidoffs, dude. They're so like the quality on these are so fucking phenomenal. They just I've been smoking them for fucking like 8 years now, I think. They're so good. I'm glad you like those cigarillos.
They're cool.
Yeah, it's a quick little like smoke and shit, you know? Like it's a quick little smoke and they sit really well. It's good after dinner and shit like that.
I definitely don't need any more than that, man.
Why? Just you get dizzy when you smoke?
No, like I don't normally smoke, so this is plenty for me.
Really? God, I could smoke like 3 of those little ones. It's just relaxing. Smoking relaxes the shit out of me. It just, I don't know. For some people it's weed. For me, it's cigars. Like weed is more pain management for me.
Yeah, I don't know. I like a blunt. You know that.
I just don't, and I think it's because I was late to the weed game. I think that's what it is, because I was late to the weed game, and it's like, like it's not my thing, man. It's not. By the way, for everybody listening, Jay Gore. That's normally how I introduce people. Normally, I fuck up their name, though. I have fucked up their name before. Like, we had Ari Spears, and I called him Ari Spears.
Oh, yeah.
Yeah. Like 12 times in 5 minutes.
Oh, my gosh.
And I posted it, and I was like, I never told you this?
No.
Yeah, we had Ari Spears on. Yeah, the Mad TV guy.
I guess I don't know who that is.
You know who Ari Spears is.
Maybe if you showed me a picture.
Bro. We can't start like this. Hold on.
Look.
Hold on.
You're gonna have real problems with me if you got to look everybody up. Because
that's the beauty of it. He was on like a show called Mad TV. Here. He had a skit where he plays DMX's grandma. You never seen this? God damn it, US Cellular. Fucking hey. Yeah, he's a comic, and he had like some issue with like this chick called Lizzo or some shit like that. I can't remember. Where they brought up like old skits that he did. Yeah, here we go. This is watch how he talks. Watch.
good grief.
Watch.
Oh,
that's his official channel. Ari Spears. Yeah. Shout out to Ari Spears.
You forget how bad
nice.
TV used to look, man.
You forgot how TV used to look?
Yeah.
Like that shitty and grainy?
It's awful.
It is, but it was so fucking good, and people weren't offended. Watch this.
Women. You know, I know you said don't let these hoes stress me and everything, but it's like all they see is the celebrity, you know what I'm saying? They don't see me, the person that I am, you know what I'm saying? I need help, ma.
Yo, son, relax. First off, I'm gonna put you up on that. Like I told you, you need to stop messing with these chicken heads from the top.
See that?
Oh my gosh.
That's Ari Spears, yeah. Dude, and he's so fucking good too. That's the thing that kills me, is that he's remained funny for all these fucking years. Like, it is wild to me. And that show was like, I remember I saw that show in the early 2000s in Puerto Rico.
Yeah.
Like, that was like my introduction to American comedy, I believe. It was either, no, it was in Living Color. It was in Living Color. Yeah, because my grandmother had cable TV, and I would watch it. And I had to I didn't understand half of the jokes because I had to translate them in my head and interpret them in my head. And I'm like, I don't get this.
Gotcha.
And then as I got older, I was like, oh, I get what they're doing now. Because it's a lot of references. You know what I'm saying?
Yeah, yeah.
So many American references. That's always been something people at the gym give me shit for. You didn't know that?
For what, figures of speech and
Just
stuff?
yeah, figures of speech and shit like that. Which is because whenever you were at the gym, it was yeah, we were just talking about this because the gym's celebrating 10 years at the as Springfield BJJ now.
That's cool.
It's wild, isn't it?
Yeah.
I've been training
That's really crazy.
I've been training for 13 fucking years and I've been 10 years under Brian.
Wow, man.
Time flies, doesn't it?
Yeah, well, yeah, it's been 16 years since I got started.
16?
Yeah, because I was 15. I was almost 16, but I was 15 when I started it when it was 10th Planet. Well, right around the corner from here,
Yeah, 10th Planet.
you know.
Yeah. This is back in those days where
Mhm.
it was it was I remember
Well,
at the
then
beginning.
there was I can't remember what order it went in. I think Revelation MMA,
I don't know. He
or
posted
we were involved with them anyway. We were in
Yeah.
the same building or something like that. And then Fit to Fight.
Yeah.
We were Fit to Fight for a while.
I was there at the very tail end of that. The very, very tail end of Fit to Fight. There it is. He's the first person. Yeah, this week is a fucking wild week for me, man. But it's the fucking 10-year anniversary, dude, and it's been fucking wild to me.
Well, yeah,
because it's man, it's a long time fighting. Yeah, see, 10 years, estimated 2013. Oh yeah, that is a video.
Started my own academy where we became affiliated with 10th Planet Jiu-Jitsu. At the time, we were the 9th affiliate. So it's kind of an early thing and kind of ground level, so to speak, of something that we thought was going to be really big. We opened up our first school, and we really were just like a ragtag group of people that wanted to train no-gi and focus on jiu-jitsu. And we had a small fight team, aspiring amateurs and people that would eventually go on to become pros. And so that was really our roots.
God, look at that. Jesus. Look at that hair. Fogel has never aged. Fogel and Mike have never fucking aged.
I'm not shocked.
Why?
Well, okay, you have to remember I've known Fogel longer than anybody.
Oh, okay. Okay.
So his connection to the gym is me.
Oh, you were the guy who brought him in?
Yes.
That's dope. That's dope though.
Yeah.
That's pretty fucking dope that you're the guy who brought him in.
Yeah, and it's been really cool because well, good grief, man. The first time I met him, I hit him with a skateboard.
Hold on, stop.
He was a you want to hear all about Fogel?
Don't say anything mean, but how did you hit him with a skateboard?
No, it's not like that, but I mean his backstory is literally just like what you would think it is, being that we call him Fogel.
I don't know what that means. To this day, I'm too scared to ask anybody at the gym what the fuck that means.
Well, it's the character from Superbad that he looks like, that he resembles.
The character, which one? The guy
with the
McLovin?
McLovin, yes.
No,
glasses,
he doesn't
right?
look like it.
Or I don't know which character is which anymore.
Yeah, it's been so long since I've seen that movie.
With the little square frame glasses. You know what I'm talking about?
I know who you're talking about, but I don't see the resemblance.
We'd about have to pull it up. I can't remember.
Yeah. I'm just not seeing the resemblance. Hold on.
You'll see it if you pull it up, actually. It's the freckles and the complexion, kind of the overall. There you go. There you go.
That looks nothing like him, bro. I get
he's grown out of it quite a bit.
Oh,
he's grown out of it quite a bit.
Okay, so I see what you mean. This was back in the I don't know. I just don't see the resemblance.
But
I
yeah,
heard a roller
that's what
coaster
they're talking
story
about,
one
though.
time.
And I think it may even be the cadence and the way that he spoke.
Uh-huh.
I'm not sure, but anyway.
You people out here just making fun of how people talk, huh? God damn. Fucking America's wild. Just invade whatever country we want and fucking make fun of people who might have speech impediments. How did you stumble upon the gym?
Well, actually, I had been in trouble, and
Uh-oh. Were you a
well,
bad boy?
at home or whatever.
Yeah.
And so my parents were like, you need to find something to do with your time, not being in trouble,
Mm-hmm.
And well, and what I come up with was I wanted to box, but they were like, well, you're going to get a concussion. And they were concerned about all this kind of crap, So I was like, all right, well, I can find something. So I kept looking
Yeah.
into like what kind of martial arts and stuff there are around. And when I come across jujitsu, I was just like, what the heck is this stuff? Like,
Yeah.
so I got my mom to take me to Fusion because it was the next town over instead of going to Springfield. And the guys there, it was like they couldn't teach or didn't want to teach and were just more like beating up on people and
Just a different vibe.
having,
Yeah.
enjoying themselves that way.
Different vibe, yeah.
So like I was like waking up wrestling with my pillow, like super frustrated, not learning anything.
And then
so that's my mom was like, all right, where do you want to go? So then
Nice.
I was like, I want to go to 10th Planet in Springfield. And that's how I met Brian.
I met Brian because, and this is funny, for me, the first experience I got from jujitsu, and I've told the story before, was there was a guy, it was in Iraq. There was a guy named Jason Powell. Like everybody used to give this dude shit because he was just really rough on people. But like me being me, I used to look at it and be like, man, something's up. Like you're not like that for no reason. Like you're like that when you've been fucked over enough and stuff like that. You know what I'm saying? Like, you know how some people, their personality is just really abrasive.
Yeah.
It's just to me, when people are like that, it's because they've been fucked over a lot or whatever. And found out some stuff that I was like, oh, that makes perfect sense. Like you've been fucked over a lot. And it was one of the down days that we had. And he liked fighting. That was his thing. And I'm at the gym and I'm on the treadmill running, and he walks in and they pull some mats out, and he fights all 12 people in the platoon, and he fucking chokes them in like less than 5 minutes. Like all of them. He goes one by one. He just fucking rear naked chokes or guillotine chokes all of them. And I was like, there's no fucking way that's true. So I never asked him because I was like too scared to ask, but that just stuck with me. And then when we got back from Iraq, I asked him, I go, hey, what's that stuff? He's like, oh, it's called jujitsu, Brazilian jiu-jitsu. So I found a guy that was a drill sergeant that he was like teaching some stuff. And then I started traveling to St. Louis, which I can't fucking remember the place that it was in St. Louis. And I was like, oh, cool. And then I remember the first time that I had to use it was apprehending someone. Like they bum rushed me and I just arm dragged them. It was like the first thing I did. Like I just arm dragged them and took his back and choked him. And I remember like cuffing the person. And while I'm cuffing them, I'm like, oh. And then after that, like I just kept training in different spots. I went in Korea. And then when I got out of the army, I was like, man, I just want to go to school and do jiu-jitsu. That's what I want to do for 4 to 5 years. And I went to different places. I went to Springfield Fight Club. I went to other places, but I can't remember if it was Fusion or Infinity or whatever the fuck it was called. And I was like, and then I went to Brian, and it used to be back on, what's the street? No, it's that way. Yeah, north side, that way. It was like in this little hidden area on the north side, past the train track. It was Fit to Fight.
Yeah.
I can't remember, but I went there and it was like, yeah, we do no-gi, come on. And I was like, yeah. So have you trained before? I go, a little bit, and trained no-gi. And then we moved to the new location, started doing gi. And I was just like, I started like actually feeling progress. Like the way he taught made sense to me. And like immediately you could see the progress. And I was like, oh shit, like I'm staying. And fucking, even when I left for Boston, when I got my blue belt.
There's a brown belt out in Mountain Grove, and I've done some classes with him. And his style is a lot different from Brian's. Brian is super technical. Well,
because he's a smaller guy.
Because he's a smaller guy, and that's what he's exposed himself to, I think, is also what it is. Like Kaio Terra is the same way. Like when Kaio shows you a technique, there's like at least 10 details minimum.
The thing with Kaio is
that he's going to point out.
It's not even the details. The thing with Kaio is, and this is like when I stayed at their gym in 2017 for a month, this was the thing that I realized with Kaio, is Kaio says, we're going to pick whatever fucking position, right? And he'll go, this is why we're coming in here, because he's doing this. So we need to do this. And we're going to do this because this is the most probable and safest way for us to go to XYZ things that we want to get to. And that to me was like, oh, that's why I'm pulling guard. That's why I have to pull my leg here. Because
I'd say
Mhm.
what you're talking about there, right there, is exactly what I'd need for sure.
Yeah.
Is like all that sort of like context in between sort of type
Yep.
stuff.
And it's funny with Kaio because like you'll ask a question. Like I remember one time I was like, hey, how do I do this choke? It was a choke from like side control. And I was like, I just can't get it. And he looks at me and he goes, because you're cranking on them. And he looked upset. And he's like, that's not how you do it. You have to pull. He's like, look where my hand is. And I was like, oh, and dude, like I think like 3 months later, I started getting it. And it was like, oh, it was just that one detail. You have to pull them. It's always that one thing, right? It's like, oh, it's like an inch, but that's like the thing. Like I never met Kyle until like I think 2014, I think. And, like I remember the first time I met him, I was like, this dude looks like a fucking baby Abercrombie model. Like, what the fuck? Like he's so little and he was so fucking vicious, like with his comebacks. Like I remember one time I spoke to him in Portuguese and he goes, Rick, I'm very proud of you. Your Portuguese cannot get any worse. And I was like,
That's so funny, man.
no, it was not. It was not for me. Not the language guide. It was not. I went home. You ever seen those videos where the guy like gets slapped and he's like taking a shower and it changes and he's still with that face. He's driving and then it changes and he's
Oh my
having dinner and
gosh.
he's still. That was me for like a day. It's like this little
Yeah. Well,
motherfucker.
I'll never forget. He was doing a seminar, and he asked me to show the technique we'd been working on.
Oh fuck, that's the worst when he puts you on the spot.
And so I got up there and whipped through it, and he goes, "Whoa, whoa, whoa, slow down! What are you, the Flash?"
I remember one time, dude, someone you were gone for this, bro. This is why you gotta come back. You gotta move you here, man. Someone talked to him in Spanish and he just looked at them and smiled. And I was even like pissed because I'm like, in my head, I was like, and it's just my ego. It was like, oh, so Portuguese is the same thing as Spanish, dipshit, you know? And I just like stared at this. This is no longer in the gym, but I remember everyone just kind of like looked at me and then they looked at Kaio because I was like, I'm not going to translate that. And I don't remember what Kaio said, but he said something real witty. He's like, do I look Hispanic? Or he said something along those lines. And I was just like, oh, God, this is going to be a rough fucking seminar, bro. Like, that's how we're starting. Did you shut up late too?
Oh my
I was just
gosh.
like, oh my God, how do you fucking. But that's the thing, man. So many people come and go, though. Like, that's what's wild to me. Like, I was talking with the blue belts the other day. I was like, man, I'm excited for promotion week, you know, this and that. And they're like, what are you excited about? Like, oh, I'm excited about, you know, purple, brown, black. And they're like, why not? Why not the blue belts? I go, because half of y'all are just gonna fucking quit. And they fucking looked at me like, what the fuck? And I go, think about it. You've been training 4 years, 3 years. I go, how many people do you know that started here that are now gone? Think about it. Nah. And bro, like an hour later after training, I got a message from one of them like, bro, yeah, this person and this person and this person and this person. They start naming people. And I'm
Yeah.
like, that's just how it is, man. Like this,
Yeah.
it's just, it's not easy. Like it is not,
No, it's not.
it's not a fucking easy sport. And it's rough on your body too if you don't do it correctly. That's the other thing. But dude, it's been a crazy journey for jiu-jitsu, man. That's how I met you was through jiu-jitsu.
Mhm.
And then you started going to I don't understand. So for the people that don't know and are tuning in, like how do you explain like a kindergartner what you do? Because I just say it's a massage, which sounds like some
Right.
happy ending Chinese thing, but
Yeah. So I'm a licensed massage therapist. That's my credential, right?
let me get you right on that there. There you go.
I should get certified in precision neuromuscular therapy, which is the what people call the modality that
What
I'm
do you
doing.
mean by modality?
Modality? So like hot stone massage. That's a modality.
Okay.
Swedish relaxation massage, that's a modality. Right?
Okay.
Sports massage, that's a modality.
Okay.
Okay. So my modality is precision neuromuscular therapy. But I don't really think of it as a modality. It's more of it's a way to think about how
The body,
to help you, essentially.
How
You
to
know what I
fix the
mean?
body. Yeah.
So I mean, to put it in the book's terms, it's a scientific and research-based approach to assessing and treating mechanical soft tissue dysfunction.
So right there, I've always wanted to ask you about this. What do you mean by studies? Like, what kind of studies were done and like how long? Because you always say this to me, and I never
Yeah.
asked you.
So now I wish I had a reference material with me. So basically, it goes back to a chiropractor whose name was Nemo.
Okay. Nemo, like
yeah.
N-E.
Nimmo, I think.
Oh, there it is. It's a chiropractic technique.
Yeah. So all of the neuromuscular stuff comes out of what he did. So it actually comes out of chiropractics. So,
Okay.
but instead of looking at your structure and going, oh, that's in the wrong place, and then just trying to pop it back in place, instead we go, okay, well, that's out of place, and these muscles are tight and need to relax.
Which
So,
I'm known for that.
and yeah, right. So, so it's just it's a different approach for achieving the same result.
Okay.
If that makes sense. So
No, that makes perfect sense.
And it's obviously, well, it's less invasive, because we're
invasive in what sense? You're not popping necks
yeah,
and stuff.
Yeah, right. Instead of cracking on your joints, we're doing something that's less less of a
Less aggressive, I would say.
right. Yeah.
Yeah.
We're being nice to you.
I don't know.
You don't feel that way
I don't
about
know.
it, but
I don't fit.
not everybody receives the same way you do. You do though.
But it works. It's
Yeah.
like the only thing besides like I like going to, but I don't feel like I need to go to the chiropractor every other day. That's where I think it's bullshit. Because I have a guy, his name is Bones, and he'll like be like, hey man, just come see me like every 3 weeks or every month at least, to just get adjusted. And dude, by God, like I hadn't seen him for like 3 months, and I've been training and lifting. And he like grabbed my neck the other day. He goes, oh man. And I was like, yeah, man, I'm just stiff. And dude, I literally felt like it was like a blood rush coming through my head when he like adjusted me. And he's like, oh, you should get massages and stuff. And that's when I started hitting you up. I was like, yeah, I gotta get this done. But
Yeah.
that's the thing. It works. Like at least for me, from my perspective, it definitely works.
Yeah, and I've seen that a lot, that people have good results with it, and everyone's different, obviously, but and well, to speak to like what we did with your forearm.
Get you a little closer here.
Yeah, sorry.
No, you're good.
You've got a diagnosis of rheumatoid arthritis in that hand,
Yeah,
right?
in both my hands. Yeah.
So you're a good example. I always try to tell people is like, look, just because you have a diagnosis for something like that, like, yeah, there's probably damage in your joints and there's nothing massage can do about that.
Oh yeah, there's
But
definitely. Yeah.
If the musculature is also having an issue, that's going to aggravate that back and forth.
So that's what I was confused about, how you were able, because like yesterday when you came over to hang out, you were like, oh, your forearm is swollen. I'm like, bro, what are you talking about? And then when I looked at it closer, I go, oh my God, it looked like an inch, like a good.
It was really, really crazy.
Yeah.
It was like red.
Yeah. Well, it just always looks like that to me. Like to me, it always looks like that.
Yeah. Like I say, it would probably come on slowly over time and you just didn't notice. You're just like, man, this arm just hurts more and more.
Yeah. I couldn't like do this. I couldn't like do that. Right. And I was just like, it's so weird, but I'm so used to the pain that it's like, yeah, whatever. I just live with it.
Yeah.
But dude, after yesterday, even my wife, like Bridget, was like,
so many of these things that we treat with surgery, like carpal tunnel, for example.
Yes.
Is, they're going to open up the connective tissue in here to take pressure off of all the tendons and nerves and everything.
Mm-hmm.
Well, here's another way we can take pressure off of the tendons and the nerves and everything is how about just taking tension out of the muscles?
So how does that, how,
right?
Explain to me, how is it that when you went to school, right? Like how the fuck do you like figure out the muscle? Because you would have to massage it in a certain way, because like the muscle fibers they're obviously wrapped in a certain way. Like, how does that work? Because I remember you going to school. I was there when you graduated, but I just
So, I learned all the muscles, where they're at, where they attach. And somewhere like the forearm, you kind of get where there's a method that you sort of think about it and feel your way through it, because there are so many muscles going so many different directions in this particular area that it's hard to keep track of all of it.
Yeah.
But I'm going to know, because you're going to feel it and I'm going to feel it when I'm on the right structure.
Yeah.
And we're getting the effect we want.
Yeah.
You know what I mean?
And it's wild when they're swollen.
But a lot of it is knowing that, okay, well, while you might be going, well, my hand is going numb while I'm laying down to go to bed at night. Well, that's actually maybe in your neck. You know what I mean? I have to know all those sorts of things also.
That's what surprises me the most, is that everything is connected to your fucking neck. Everything. Like everything. And I know that sounds obvious to you, but to me it's like, oh, my arm hurts, so it must be my,
all you have to do is pull up a picture of
Mhm.
the erector muscles in the back.
What? The what?
The erector muscles of the back. Yes, exactly what it sounds like. They erect the spine. Okay.
I tried to keep a fucking okay. So here it is.
Yeah.
Hold on. Let me pull this up right here so everybody can see it too.
When you have a look at those muscles, you're going to realize, like, oh, like just like when you go
which one do I pull up? This one.
Just like when you pull the back strap out of your kill, right? That runs from the hip all the way past the shoulder into the neck. That's a huge long muscle, man.
So this right here. Oh, okay. I see it now.
And so, yeah, if you've got a distortion in your hips, you might end up with a headache.
Okay.
You know,
okay. I'm seeing it now. That's just too much to me.
It's
to
pretty
me,
wild.
that's just too much.
It's really wild.
To me, that's just a little too much right there.
Yeah. Well, it's a kinetic chain, right?
Yeah. So that's okay. Okay. Erector spinalis. Okay. Yeah, and this is one of the reasons why I was telling you that you need to get with VA, because this is not like, I don't believe this is on their repertoire of treatment, where I know for a fact, like Sean gets like Swedish massages and stuff like that.
Doctors are mostly ignoring what I'm treating, which is mechanical soft tissue dysfunction. We're talking about
that doctors lie.
Pain that gets better or worse with movement or position.
Yeah.
It's soft tissue. They don't care about it because there's nothing they can do about it.
But that's
except give you pills.
But that would be,
yeah,
that is true. That is true.
Because
everything is just pharmaceuticals.
So one of my clients told me, they said it was psychosomatic.
What?
That means it's in your head. It's psycho being your mind, and somatic being your body.
Okay, I know psycho, but I know somatic.
Your pain is psychosomatic. Your pain it's all in your head. It's not really happening.
I've never heard someone tell someone else it's the. Okay, go on. I've never heard a doctor say that, or someone tell me that a doctor said that to them. That's wild. Like, I didn't know they were psychiatrists now too, because it's like, hey, PTSD, that's not real. It's all in your head.
Okay, well, here's a nasty example. When I was going through school,
get you a little closer to that.
When I was going through massage school, I had a genitofemoral nerve entrapment.
Okay, you're gonna have to use smaller fucking words with my ass.
The genitofemoral nerve. All right. It passes through the iliacus or the psoas. I can't remember which. One of the hip flexor muscles.
Okay.
Okay.
So we're talking about hip flexor.
On its way to your junk.
Okay.
Okay. So when you have a nerve entrapment, what happens is you'll have like a random like shooting pain.
Okay.
Or you may have like a numbness or some kind of a nerve sensation. Sometimes it could be like a burning or tingling type thing. I was just having like a shooting pain, right? Where we're talking about. But through treating the hip flexor muscles, and we treated a lot on both of them, iliacus and psoas in school. But that's what alleviated that and got that to go away.
How did you find this out? Like, because the first time when you told me about what you were doing, I was like, I support you, buddy. And I was like, this just sounds some weird ass shit. Like, this just sounds like some fucking voodoo shit. But fuck. It's legit.
Well, whenever I would throw myself out of whack, either doing jiu-jitsu or I was longboarding downhill like speed skating type stuff.
Yeah.
Whenever I'd throw myself out of whack, a massage is the only thing that I could find that helped me. And like, well, like and it's kind of funny. One of the first times I come over and worked on you, I don't know if you remember, and I hope you're okay with me sharing this.
No, you can share it. Yeah.
Okay. That you were all bound up in all different places in your ribs and your back. And after we got done working on you, you ran to the bathroom. You had been
John, because you worked on John.
You had
this is
been
when I lived in the apartments.
Yeah, you had been constipated, and you were like, dude,
Yeah.
I was
Shit,
finally able to relieve my bowels.
Yeah, I shit for like 3 minutes nonstop. Like it was just coming out. Like, and then my back felt, like it felt like somebody was doing this on my, like if someone was to grab your neck, like do this, it felt like a giant hand was doing that on my back until
Wow.
you like pressed it. I remember that because John was there.
That
John was
so
also
crazy.
there. Yeah.
Yeah. So, and I can't explain that. But anyways,
Yeah. No,
I've had a similar experience myself, not to the same degree that you had. But before I went to massage school. And so I knew like there's a lot more to all this stuff going into it. I didn't know what I was going to learn in school, but it turned out that
because I remember when you told me, I was like, hey man, I'll be here. If you need a ride, I'll take you, you know, but I never really thought.
I mean, I knew they were going to get into more clinical type applications for massage in the second semester, but I didn't know exactly what that meant at that time.
Okay.
You know,
so it was just one of those things like,
yeah,
yeah. So do this.
Yeah.
That's fucking wild.
Yeah. I was like, I know there's something to this. And then going through school, they just happen to have the right program.
So did you ever have a moment where you were like, yep, that's it. Like this is
no, Richard, because even so I took a break from massage for quite a while and just come back to it a couple of years ago. And in that time since, well, like I think of it just like the way you would think of like jujitsu, right? So in jujitsu, it takes 10 years to get your black belt if you're fast at it, right?
Yeah.
Same sort of deal here is like, this is going to take a lifetime of learning because somebody's always going to present you something you've never seen before.
Yeah.
You know what I mean?
It's like jujitsu in that sense. Yeah. I get what you're saying, man.
Yeah. And so you're constantly trying to get more efficient with your technique so that basically you're giving people the most bang for their buck that you possibly can. I want to be able to get through as much treatment as I can. And I'm oftentimes I'm treating something and then I'm looking at the result and I'm going, okay, yeah, that did it. That's enough. We can go to the other side or I might go,
everybody's different.
Or I might go,
telling me.
That didn't quite get the result I wanted. So what else can be pulling in the same direction? Or does this muscle need more treatment before we move on? And that's sort of how I work, really. Because I'm like, I don't want to touch something that I'm not creating a result with. Does that make sense? Like everything is very intentional when you get on my table.
It's interesting because I'm trying to find the picture because I have a picture of the first time you worked on me, actually. I actually do have that picture, and it's you, me, and John in the apartment back when I lived at Chardonnay. And I never forget, I was like, oh, like this shit works. Like this shit fucking works, especially like on my shoulder because I always had shoulder pain. And VA was like, yeah, you just fucked up your shoulder. Thanks for playing. It's it's what happens when you fucking do dumb shit to your body in the military. And it's like, oh, and to me, the problem I have, right, is, and this is one of the reasons I don't do medical interpreting, is because there's so much. There's just so fucking much to like learn that it just feels like it's just too much. It's just so much. So whenever someone tells me something medical, I go, all right, cool, no problem. Thanks, man. Like that makes sense. And then I go talk to someone, it's like, actually, and then normally it's people like you that they can explain it. Like if I was a fucking kindergartner and I'm like, oh, okay. So now I see. Like yesterday when you were explaining my forearm, my wrist, you're like, no, like it's this and this. And I'm still arguing. And then I'm like, oh yeah, I'm wrong. But again, it's because I don't know. I just don't know any better about it.
Yeah, there's a hurdle to go through with any client when they come in because they don't understand what massage can do.
Have you ever had someone think it's like a happy ending sort of thing?
Well, no.
No? That's pretty cool though, that you don't have to deal with people like that.
Yeah, that is cool.
You're looking at me like you never thought about it. Like, oh fuck, no, I've never had someone tell me. Is like, is there a hand up
No,
at the end of
okay,
this?
let me tell you the funniest thing that ever walked into the
Oh,
clinic.
God.
Okay.
Don't mention names.
No. Of course not. No, this guy comes in and he's heavy set. Do you remember? Did you ever watch Viva La Bam? Did you ever see that
What's
show?
that?
Okay, when I was in high school on MTV, there's this show called Viva La Bam. The
Bam Margera?
yeah, that's the guy,
Okay.
the
okay.
professional skateboarder. It's about him just doing like jackass type stuff around his mom's place or whatever. And his stepdad was there.
Around his mom's.
That's what it looked like to me. I don't know. I'm just
Okay.
describing what I saw, man.
Okay. I feel like you're laughing because you're like, how the fuck do you not know what this is?
No, well, nobody should know what it is. It shouldn't even exist. Listen.
Just this dude terrorizing his mom and his stepdad. That's what this show's about, I guess.
Okay, there was an episode of that, and you can pull it up on a GIF on your phone, okay, of Don Vito he's doing this number, and he's trying to get this part of his neck to swing because they wanted him to sing, what's the term, vibrato
Okay.
or whatever, like where your voice vibrates, and the way he was getting his voice to vibrate is he was swinging his gullet, okay. This guy comes in the clinic looking like this guy.
Oh, shit. So you were like,
no, I mean, it wasn't like the resemblance wasn't so much that I was like, oh my God, is this Don Vito? It wasn't like that. No. Same body type, this guy, but he did the same motion when he came in because he was there to cancel his appointment.
oh God, no.
And he goes, watch this. And he swings his gullet. And he goes, when I booked the appointment, I couldn't do that.
So the whole time where you were working at him, where you were like,
no, I didn't work on him. He was there to cancel his appointment. Here's what I did is I took my client and ducked out into my treatment room and I let somebody else handle it.
yeah, because you were like, I'm not gonna be able to not laugh. I'm not gonna be able to sit here and hold a straight face. I've had instances like that interpreting is what's funny. Like I've had kids say some shit. Like I had a kid one time I was interpreting and her sister told a story of how she came to the States, which was really sad. And then the kid's just sitting there like nonchalant and someone goes like, yeah, you have any questions? She goes, I don't really care. I'm American. Yeah. See? So I was like, I just interpreted what she said and everybody starts laughing and I go, this is not fucking funny. Like, I don't know how you find this funny. But all right. That's fucking wild. Did he sound like him? He was like sounding like him too and shit.
Kind of. Yeah, he had that same energy, like kind of frantic and
So how does it okay, so how does
well,
it
he was
work with-
Italian, clearly.
Okay.
Probably drank too much espresso.
Oh my God. What does that have to do with anything?
I don't know.
You just fucking spitballing like espresso.
I'm just laying in on him now.
Just fucking, you're like, yeah, fuck it. I'm balls deep in it now. Like I might as well. Like, yeah, I mean, you're balls deep in it. Like you ain't got nothing else. I cannot fucking find that picture. It is fucking wild to me that I cannot find that.
What are we looking for?
It's literally a picture of you working on me and John in the back going like this.
Oh my God.
I remember there's a picture of you.
It
right
probably
there.
got reported.
It's a picture of you right there.
Oh my gosh.
Yeah, we were watching Worlds.
I'm getting the worm guard
Yeah,
done
the
on
Worm
me
Guard.
right
That
there.
was when the first time we saw Worm Guard, fucking Keenan Cornelius out here. What the fuck is this? What was this? Oh, that's when I got my blue belt. Yeah,
That's awesome.
not really. That was
Well, dude, I haven't seen myself like that, man. That's really cool.
Really?
Really, man.
That's fucking wild to me. Because
You need to go through and send me the photos you have of me because I don't have any photos of myself.
Oh, you want me to send you the ones of you sleeping?
No. No, don't even bring that up again.
Fair enough, good sir. Fair enough. I'm telling you, dude. I told that to somebody one day. They were like, "What do you do if you want to fuck?" And that's from a movie too. Like, what do you do if you want to fuck with somebody? I go, I just send them a picture of them sleeping. And they're like, but how do you get into their house? I'm like, that's the part that's for you to figure the fuck out. Like, how the fuck did I got in here?
No kidding, man.
Yeah, these are all fucking. It's always cool to me to see, like, I don't have much social interaction, so jujitsu's always been like my way of social. Oh my god, there it is. There it fucking is. There it fucking
What the hell?
John. For everybody, this is a
Dude,
very old picture.
how-
Very old picture. Oh my god. Yeah, John's just grabbing it fucking in there. So 2016.
Where the hell are we?
That was the apartment I had. That was a Chardonnay. The apartments.
That's it?
Yeah, that was.
How fucking high were we?
I didn't smoke back then, remember?
Good grief.
Yeah, I didn't smoke back then, dude. I did not smoke at all.
I don't remember that.
Yeah, that was the first time you worked on me. Because then you worked on some other dude, and you worked on John. And John was also like, oh shit, like my back, like his lats and everything were working and shit in his thigh, because he has a lot of issues with his feet. Because he's always fucking running. Like, that motherfucker just likes to run. Like, I'm like, what the fuck are you running away from? He's like, my feelings, bro. And I'm like, god damn it, John. There was a true conversation. I'm like, why do you like running so much? He's running away from my feelings. I'm like, hey man, if it works, if it fucking works, brother. So what was school like? Like, the schooling for this, what's that like?
Well, the first half of it, we're learning a lot of book stuff, and we're
Mhm.
doing Swedish relaxation massage techniques. Which, so massage actually shares history with nursing. If you go back to like Florence Nightingale.
Really?
Yeah. So, well, early on, that nurses were just trying to help people, and they didn't have a bunch of technology like they do now.
Did
So
they give
massage
blowjobs
was
back in those days? 'Cause
well,
that sounds like,
if
I know
only,
doctors used to get women off as a form of like therapy.
if only we had a time machine, bro. I don't know what to tell you.
You're like, listen, ma'am, are you a nurse? Yes. What's the best way to calm down a man?
Good grief.
Listen, it's a part of the body. It's a muscle. It has blood vessels. It had you got to massage it, Jay. Like,
I'm not going to touch that with a 10-foot
so anyway, so it goes back to massaging and people help it, right?
Yeah. I mean, so, and well, one way that you can help somebody is just to give them a massage, obviously. So, but yeah, so that's where effleurage and petrissage, all these French words that are embedded in the massage field, come from, is the same history that nursing shares.
That's interesting.
Yeah, it goes all the way back to that. So
I think there's just a negative, like, in all seriousness, I think massage nowadays has a really negative.
there's yeah, and I don't know that that's not entirely maybe on purpose.
What do you mean?
Like propaganda wise or whatever, because they want to push you toward the pharmaceuticals. That's
that makes sense to me. That does make a lot of sense to me.
So like if you see how massage is portrayed in movies, it's always shady.
Yeah, like sexualized. It's sexualized.
Right. And it's always like we brought a mobile table to your door type,
Yeah.
like it's not like a professional spa environment usually or whatever, or if it is, then it's only towels is what's covering them up instead of having sheets like we do in reality,
Yeah. Because in Japan they have like they have hot springs and stuff, and they also have like hot rock massages, whatever the fuck it's called. Like, when I went to Japan to do it, I was like, in the army, you have to take a briefing before you go somewhere. So one of the briefings was, hey, make sure that this place is reviewed. Make sure when you go online and you check it, because, you don't want to get caught in one of those things. And then as a service member, and I remember I went, and it was the first time I had ever gotten a massage in my life. It was like 2011 or 2012. And I was like, I came out and I was like, oh, bro, like it's going to sound silly, but like I could like see clearer. Does that make sense? Like, I could just see clearer, and because I was so relaxed.
Wow,
And,
man.
Yeah.
That's like a lot of that's a lot of relaxation.
Yeah. No,
That's I'm serious though. Or that's a lot of tension, like one way that you to have that kind of a difference when you walk out to feel like you're seeing different.
Yeah, like literally it was like, I can't
like
explain it. It was like everything,
like you felt lighter or something.
It was like the first, well, yeah, I felt lighter, but I felt lighter when I got out of the hot springs. Like when I got out of the hot springs, I felt way, like I was like, I was like, oh, like I could grip better and shit. I was like, holy shit. Because I never spent time on that. Like in the military, when I was in, you never really spent time. Like there's no really recovery. You know, does that make sense?
Yeah.
Like they don't really, it's like, no, 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 go. So that's why, like, as I got older, like I started like chiropractor and like, you know, ice baths and all that other shit. And I've been doing that for like 6 years now. But it's like, dude, I'm 36. That's fucking 30 years. And I never really thought about it. Like never really even considered as a form of like therapy. Right.
Right.
Because that's one thing I always consider like what you do until when you started like fixing certain things that were issues. I was like, oh, this is like therapy, you know? But now it's like, oh no, this can really help. And for me, the biggest thing is like veterans, man, like veterans and first, especially firefighters, bro. Like firefighters should have this. Cause you know, firefighters like military combat military guys, like you're carrying a shit ton of weight. What do you think is the first thing that's carrying that?
Right.
This right here.
Yeah, no kidding.
Know? So I just never understood. That makes sense, the whole propaganda ordeal. Cause dude, it's yeah.
Yeah. Well, the thing is that massage is very labor intensive, so it's expensive. And
Yeah.
people is the one thing that we don't like paying for in this society. You know what I mean? So we'll pay for technology.
I disagree with that. I don't know if you've seen how much human trafficking is
Well,
happening
okay,
in the
well,
world, but sir.
That's a very good point, sir. Yes, you're right.
You're talking to someone who knows a little bit about it.
Yeah. So,
but I get what you're saying. It's
as far as paying people for their time, that's
Yeah.
not what we want to do. We'd rather put a machine on that job. You know what I mean? And no, well, seriously. Well, here's an example.
Mhm.
When you're in the hospital for certain things, they're going to put those boots on you and they fill up with air and compress your legs. That there's a machine doing massage for your lower legs, making sure you don't get blood clots.
Oh, that's what that's for?
Yeah, making sure you don't have a clot problem in your lower legs,
Oh,
because you can't get up and walk, so you've got problems getting blood where it's supposed to go.
That's interesting. I never knew that. I almost bought one of those just to see if they were legit. Because I had someone that was selling it like a couple months ago. They were selling like super cheap, and it was like a really nice one. Like it looked like
Yeah.
a suit. And he's like, it like covers up to your like your upper part of your thigh, I think, or something like that. I can't remember like all the way up.
Wow.
And I was like, nah, man, like that sounds dumb. He's like, no. Like if you train a lot and you run, but dude, again,
Keep
like,
the fluid off your feet and
yeah,
stuff.
dude, like again, like military
Yeah.
guys should be doing that. Like 100%, bro. Especially guys that like train hard.
Yeah,
like that.
anybody that's using their body really hard, it's just part of the maintenance thing is, well, and I think that a lot of this stuff that, like I was talking about earlier, carpal tunnel or
Yeah.
like the bicep, for example, attaches right in the rotator cuff.
Yeah.
And so when it's tight, it warps the rotator cuff. There's more friction with everything that you do. You're putting damage on that joint because of that muscular problem that you have.
And then it has to pull from other muscles. That's why you'll feel like tensions here and shit, right?
Yeah. So what I'm saying is like, if we take care of ourselves in the meantime, instead of waiting until it gets so bad we need a surgery, we're not putting damage on the joint because the muscle's not pulling and creating that friction and causing, just like anything else, if your car's out of line and you're driving it down the road, you're doing damage to it.
Yeah.
Yeah.
Yeah. That makes that explanation right there makes a lot more sense to me in regards to how to look at it. Because I never, like, again, I just never thought about it. I was just like, like, all right, whatever. Like, I'll just take ibuprofen, or I'll, now it's like, I'll take like a small edible, like a 5 milligram or something. But yeah, especially after yesterday, man, like I definitely got to get you back in because you should be so busy, bro. I've always wanted to ask you this. What do you do for your strength grip? Because there's times that you're putting pressure that like my hands start shaking when I feel it because I'm like, how the fuck can you do this all day?
So one thing you have to realize is when I'm putting pressure on something like a trigger point and you're having that reaction, well, remember when it relaxes, I'm giving you the same pressure. You're not having the sensation anymore. And now you're like, yeah, that's nothing. That's not anything anymore. Right.
Oh,
So
because the trigger.
it's still the same pressure, Richard. So, but now you don't feel like it's that much because there's not anything wrong with you right there, like there was a second ago. So look, man, what we're doing is we're finding structures that they're hypertense.
Yeah.
And they're sensitive because of that. Okay.
Okay.
So when we put pressure on them, they're like, whoa, because they're already in that state. They're already doing this anyways.
Yeah.
You know, and then we put pressure on it and you go, woo. And then, so then you have to relax and we go, okay, we're going to slow down. We put just a little bit of pressure on it at a time. And as it relaxes, it's less sensitive. I can give you more pressure. I give you that more pressure and then it can relax more. And we just keep following it in until it totally relaxes.
That's why I breathe. Like I breathe like
yes.
I talked to a guy that I'm trying to get on the podcast. He's a welding diver. You ever seen?
Oh, wow.
Met someone? So I was like, what are like, how do you like, what's some things that you do? He goes, oh, you just have to relax. I go, bro, you're fucking hundreds of feet under the water with a suit welding, motherfucker. Like, and you can't see sometimes. He goes, yeah, one of the things you do is the way you breathe. So like, if you ever notice with me, even when I roll, I'll go. And I'll do that for like 10 seconds. I'm just trying to let air out to lower my heart rate so I can relax. Like most people don't realize that.
That also expels more CO2 when you purse your lips and really push.
Most people at the gym, when they see me doing that, they laugh. And I'm like, no, this is how you relax your heart rate.
That's like, and especially like as soon as you fight out of a choke, you're like,
yeah.
you know, like
most people also, the problem that most people have too is they breathe right here instead of breathing right here. And that's one of the things that took me years. Like I remember when I saw the I think it was
it's really difficult.
It is.
Yeah.
But once you learn it, bro, you're like, oh my God, how the fuck was I breathing incorrectly? Because I saw I think it was choke. I think it was like one of the Gracies did a documentary about it. And then I got a book about it because it's all it is. It's like yogi breathing is what it is, but it has like a fucking technical name for it, which is just like how to like completely relax yourself. And dude, I've seen it because we've done it here. Like my wife, the first time, when we first started hanging out, I would get like irritated about something. When I get irritated, like if I'm really irritated, my eye twitches. If I'm not irritated, I just kind of like stare at you and I just like shake my head. But then like I've come to learn over the years, like I just like relax. And she's like, no, that doesn't work or whatever. So we would put a blood pressure machine on me. And like she would take it and then I do it for like 2 minutes and then she'd take it again and my blood pressure was lowered. And she's like, what the fuck? And
that's
awesome.
Like,
no, that's
so cool.
But that's legit, like Hoyler or Hoist. I can't
Of course, the mind has an effect on the body and vice versa.
It's all it is, man.
Yeah,
it's
if you can
things like that.
If you can find a way to take control of one or the other, then you can access.
To me, the
other
biggest,
side.
For me at least, the biggest issue has always been mastering my mind. And like, I think in the past, since I got married, actually, in the past like 3 years, I've gotten way better at it because I have like a place to, and you know, this is the thing, is like you've been in my house, like it's like chill, like there's no problems. You walk in and it's like, oh man, it's chill, and that's because of my wife. Like my wife is like that. She's like, don't be bringing shit from the outside here. Like this is where we chill. This is headquarters. You know what I'm saying? It's kind of like a safe space, so to speak, but I call it headquarters. It's where you go to, like, you know, because in the military, right? And I say headquarters because in the military, whenever you do an invasion of some sort, you have to have a place called headquarters, which is where you get your information, which is where you get everything that you need, your resupply, right? You can't do anything if you don't have a place to do that. So it's the same for me. It's like my house is where I go to like relax. But it's really interesting to me how very few people take this as like an approach to not heal, because heal is not the word, to like deal with problems. Like it's just wild to me. Why do you think, besides the propaganda, like do you think it's also like, what else do you think is the problem as to why that is?
Well, it's a lack of understanding of what it's capable of. It's, you know, people
Apologize for that.
People don't know where to go with what they got. You know, they're hurting. They're looking all sorts of different places. And I'm just hoping they look here because I've got what they need. But
So how would you,
it's
to anybody? So here's my question to you before we head out. How would you, what would you tell people who are like in pain, like muscular pain and all that other shit? Like, what's something that you could tell them? So I could also tell them to explain them better, like why they should come to you or why they should seek out neuromuscular massage therapy.
If you've got pain that gets better or worse with movement or position, that's what we're classifying as mechanical soft tissue dysfunction.
Can you say that again?
Okay.
Can you repeat that again?
Mechanical soft tissue dysfunction. It's something that gets better or worse with movement or position.
Ooh, that's good.
Okay. So
Okay.
one example is like right now I've got a tightness in my low back. Right. So like when I start to bend forward in my chair, sorry, I'm gonna mess up this.
No, you're
cable
good.
here.
I'm watching. You're good.
So like, yeah, like right there, as soon as I start to bend forward, I can feel my low back. It's not super painful. It's uncomfortable. It's tight, like it's pulling.
Yeah. But it's not something that you should just let it be.
The assessment for that muscle is we look at the low back whenever you go to bend forward like that. And if there's still a sulcus, like the low back isn't able to round in those lower segments, then we treat the multifidi.
You know who has that issue
in the
a
low
lot?
back there.
You know what type of people that do construction work?
Yeah.
Construction work. Because they're doing this. They're doing this motion right here. Or picking
Yeah,
up
bending
or
over.
shoveling. Yeah.
When they
I
should
didn't-
probably be
I
using their
didn't
knees
think
more
about
and stuff.
that.
Yep.
Yeah, I didn't think about
That makes sense.
That's a good demographic right there.
But yeah, so that's just one example of how when you come in and tell me this hurts, XYZ hurts when I do XYZ action.
Yeah.
Or when I lay in XYZ position. Okay. Then I'm going to take that information and I'm going to use it to figure out what muscle I think is the problem.
Oh, that's good, man.
And I'm going to go right to that muscle. We're going to treat the attachment. We're going to treat the muscle belly, and then we'll treat the other attachment. Hopefully we'll find where it's locked up and get that thing to relax. If not, there's probably other muscles that are involved in the dysfunction. We just keep working through all those and we'll come back to that.
Dude, that's a really good way to explain it. I never heard you explain it like that. Like I'm gonna have to memorize that later. That's really good. Where can people find you if they want to use your services, Jay?
I am at Relevant Manual Therapies in Kabul, Missouri. I'm starting next month. I'll be also at Ozark Massage Clinic in Ozark every other week. But yeah, so, and if you're, we just were looking at some of the demographics on your podcast, and we've got people from all over the place. So look, if you're elsewhere, not in Missouri, try and find a precision neuromuscular therapist, and you've got to kind of, unfortunately, be vigilant in the market, because a lot of people are saying we do precision neuromuscular, and then you get there and they just give you a regular massage.
So what are some things people can ask for that it's very easy? Like, okay, how do I say this? So for interpreters, when people say, how do you know the difference between an interpreter and someone who isn't, someone who speaks Spanish? Well, look at what training they've conducted. Are they accredited? Do they have a degree in it? Do they have XYZ experience? Do they have, like, how do you, for you, how would that look like?
So the easiest way would be if they were already certified through precision neuromuscular therapy. Then
is that an institution that?
Yes, that's an organization that, PNMT.
What's it called?
I don't know if it'll be pnmt.org, maybe.
Let's see. We'll find out. All right. Okay, there it is. There it is. PNMT. Yeah, that'll work.
Yeah, pnmt.org. So
November,
if your therapist is certified, which I'm not certified, but I do practice this modality effectively. So,
but you
don't necessarily have to be certified to do it, but that's the easiest way to know. Like, yeah, you're getting real neuromuscular.
But you
therapy.
went to school for this, though.
Right? Yes, I have. These guys do. And what do they call it? Oh, CEUs.
Mm-hmm. Oh,
continuing
education.
Like
education. Interpreters. Yeah. Okay.
Yeah. So this is one direction you can go with your continuing education,
and then you can do what you do.
Right. So if they're not certified in neuromuscular, then you just have to ask them questions. This is the pain I'm having. How are you going to assess that? And what is going to be your kind of treatment approach?
What would the answer, regular answer to that be?
So it depends on what it is, obviously, but what you're looking for is you want the therapist to obviously have actual way that they're going to go about figuring out what to treat on you. And
Yeah,
not,
'cause you always explain.
that's essentially what you want to see, is that they're actually thinking about how they're going to get to the answer to your question.
Okay. That's a lot of fucking information. I didn't think it'd be that much. Dude, thank you for doing this. Like, I greatly appreciate it.
You're
I'd love-
welcome, man.
yeah,
I
I'd love to
enjoyed it.
have you back, because it's really interesting how much there is in it.
And there's so many different directions you can go with the conversation with the stuff, you know, like I had a client tell me about, they were watching somebody on the Joe Rogan podcast that was a neuroscientist of some kind.
Mhm.
They were talking about like hacks, like if you just get a horizon view, that's really good for your serotonin or something.
Yeah, I get what you're saying. Like, there's also EFTs, emotional. It's like emotional, like how to disrupt, like when you're feeling bad, right? Like, one of the things is you can do tapping. You ever heard of tapping?
Huh.
Tapping is when you go like this. There's like a way to do it, and you do this, and then you do it here, and then you do it here, and you do it here, you do it here, do it here, and you'll feel a calmness coming in. It's like disruptors. It's like I hate to say it's like interrogation, right? Like in the Army, you take a bunch of classes. We took a class on interrogation, and one of the questions I had is like, if you're being interrogated, and it's like, don't think about it as interrogation. Think about it, you're going through something shocking, so you have to do something to disrupt this. So like, throw cold water in your face, or like go smoke. He's like, smoking is one of the best things you can do because it relaxes you and stuff like that, and nicotine helps. And I was like, oh shit. And then EFT is another one you can do. It's called tapping as well. There's a lot of artists, like Pink does tapping. Like my wife's a huge Pink fan, and she's seen her like do it. And whenever my wife met me, I was doing it one time, and I was trying to be like, I try to be very like, I'll do it sometimes on the podcast. If I'm like too excited, you'll see my hands go here, and I'll go like this. And in reality, I'm just tapping. Tapping. And then you'll see me go like this, but you can't really see it, right? So I'm doing that just to relax myself. And it happens sometimes because you get a guest and the conversation's going. You're like, oh shit, we've been here for 2 hours or something like that. It's like, this is great. Oh shit, let me relax because I'll say something stupid. But yeah, no, man, this is great information, dude. I appreciate you doing this, man. I really do. And I love to have you back. And to everybody at home listening, man, like, go subscribe on the YouTube channel, subscribe to the Patreon so we can afford some ramen, and hit Jay up. We'll put all his information down below. So thank you for everybody listening, man. Hope everybody got as much out of this as we did, because this is, as I did actually, because this is a lot. It's a lot of information, man. Thank you, bro. I appreciate you.
You're welcome.